Good morning, everyone. I'm Dr. Howard Koh, a professor at the Harvard Chan School of Public Health and the Harvard Kennedy School, and it's my great honor to welcome everyone to this two-day national workshop organized by the National Academies of Sciences, Engineering, and Medicine, and sponsored by the CDC Office of Readiness and Response. This workshop is entitled Navigating Infodemics and Building Trust During Public Health Emergencies. And I've had the great honor of first chairing the planning committee for this workshop over the last number of months, and now serving as the moderator for this National Academies workshop for the next 2 days. Let me begin with a special thanks to the 15 experts on the planning committee who generously gave us their time, attention, expertise, and input to help shape the agenda and themes for this workshop. A number of planning committee members are also serving as moderators, and I want to thank them and, of course, send thanks to the many distinguished speakers who will be sharing their expertise with us over the next 2 days. And, of course, before we begin, I want to thank the tremendous team at the National Academies, Matt Masiello, Lisa Brown, Sarah Lunsford, and Maggie McCarthy, who demonstrated tremendous dedication in spending countless hours to organize this workshop. But most important of all, I want to thank everyone nationwide who is taking time to attend today and tomorrow. But this workshop could not come at a more important time in our public health history. After 3.5 difficult years, some may argue, justifiably, that the pandemic is in a much quieter phase, so we should just move on. And we all know that the official national public health emergency is set to expire in a month. But our work to rebuild public health has just begun, and navigating infodemics and building trust remains a critical priority for now and for the future. More than ever before, strong and effective public health efforts to protect people and save lives depends on effective risk communication systems. And with every public health emergency defined as a situation where the scale, timing, or unpredictability threatens to overwhelm routine public health capabilities, our country must learn, adapt, improve, and be better prepared for the next one. I have lived and learned through much of this history with many of you. When I served as a Massachusetts Commissioner of Public Health during the anthrax attacks after 9/11, I saw up close and personally how our public health system, usually invisible, was put to an extremely visible test. We all learned back then that the critical importance of emergency risk communication was to educate and support people during a time of great uncertainty and to address the tremendous fear that engulfed the nation. Trying to understand the threat of terrorism and bioterrorism at that time involved complex collaborations with all sectors of society, especially and including law enforcement. When it was all over, there were 3,000 deaths from 9/11, 5 deaths from anthrax, but millions around the country terrified. The CDC back then put forward a set of emergency risk communication principles that served as a template for all of us in public health going forward. I remember studying and teaching those principles often after I left state government and went to academia, where I worked with colleagues, including a number involved in this workshop, as head of the CDC-funded Harvard School of Public Health Center for Emergency Preparedness back then. When I joined the Obama administration in 2009 as U.S. Assistant Secretary for Health, the world's last pandemic, H1N1, was on the horizon. And once again, the usually invisible work of public health was made overtly visible. Our nation subsequently rolled out new H1N1 vaccines in one of the largest national mass vaccination campaigns at that time. And the nation ended up focusing on that threat for the better part of a year. And coordinating response was complicated, especially including issues around vaccines and vaccine hesitancy. When it was all over, according to CDC estimates, some 13,000 and perhaps up to 18,000 people died. But now, in 2023, the nation has witnessed the havoc of how a multi-year COVID-19 pandemic can disrupt all of society, especially since an unfathomable 1.1 million people have died. The overall impact has challenged not just our physical well-being, but indeed our collective emotional well-being. It has disrupted every sector of society, not just the health sector, but also business, education, and transportation, just to name a few. A major factor in this pandemic has been the concurrent infodemic that has complicated public acceptance of evidence-based life-saving preventive measures and has eroded trust in public health, affecting states and local health departments in every community. So we are here today because we know that once again, emergency risk communication systems before, during, and after a crisis need to be updated. Today and tomorrow, this workshop will strive to meet the following objectives. First, develop a shared understanding of the modern health information ecosystem and examine the impact of infodemics during a public health emergency. Second, examine the public health capacities and capabilities that are needed to manage infodemics during a public health emergency and throughout the disaster management cycle. Third, identify the roles, responsibilities, and partnerships among relevant organizations and agencies in managing infodemics during a public health emergency. And fourth, examine interventions to prevent and mitigate the harmful effects of infodemics and identify research gaps. Now, as our planning committee started our deliberations, we noted that many definitions of the term infodemic exist. So in the context of this workshop, we offer this guiding definition as follows. An infodemic is the rapid spread of large amounts of sometimes conflicting or inaccurate information that can impede the ability of individuals, communities, and authorities to protect health and effectively respond in a crisis. So for day one, today, we will first examine what the information ecosystem is and what an infodemic is, and discuss its impact on health and public trust. Then several panels will focus on key elements of infodemic preparedness and response. Our final session today, day one, will explore the capacities, capabilities, and collaborations necessary to effectively implement these interventions. Then for tomorrow, day two, we will explore interventions at the information, individual, institutional, and community level. And we will conclude tomorrow, day two, with a roundtable discussion to paint a vision for the future about a public health preparedness and response system that can equitably manage infodemics while also building trust before, during, and after a public health emergency. We hope for this workshop to be an interactive 2 days and encourage you to ask questions and provide comments through the Q&A window on the event website. And while you're on the website, please take the opportunity to review the agenda, the biographies of our distinguished planning committee and panelists, the list of workshop resources, and the very important commission paper authored by colleagues at the Johns Hopkins Center for Health Security. This paper comprehensively identifies infodemic management tools and approaches up to the present time. And then when the workshop is done, the National Academies will produce a publicly available rapporteur authored workshop proceedings in brief, which should lay the foundation for future endeavors nationwide. The proceedings in brief will describe only the presentations and discussions from the workshops and contain no implied consensus, conclusions, or recommendations by any group. As you can imagine, we cannot fully address the entire range of large and complex topics, and we can't cover all the nuances and complexities. but we must begin. So that's what today and tomorrow are all about. Thank you again for joining these critical efforts on behalf of the public health of our nation. And I'm looking forward to working together with you to rebuild, renew, and revitalize public health for the present and for the future. So thank you very much. And now I'm going to invite Kevin Griffis, the Director of the Office of Communications at CDC, to share some opening comments.
Thank you, Dr. Coe. CDC is pleased to help sponsor this National Academies workshop for the next 2 days. This is part of the work CDC has been doing with the National Academies, starting with the workshop last year. And this event and the commission paper on the current infodemic learnings that we'll publish after it. What information flows, how it flows, and where it comes from, particularly during emergency, has an impact on the public's health and for all our work. We've witnessed this throughout the COVID pandemic. We are grateful for the National Academy staff and the impressive group of scholars and government representatives who've come together for this workshop to determine what the science tells us today about infodemics and practical best practice actions we can take to address them. I want to take a minute to go through our current thinking and work in approaching mis and disinformation. We can go to the slides, please. Okay, so addressing misinformation and disinformation really is an issue that has probably existed since the first doctor gave a patient accurate medical advice, but tackling it at scale is still fairly new, and why it is critically important for protecting Americans' health. Many agencies are trying to address it now, and here's what we know. Across the U.S. government, we're developing coordinated approaches, and that is happening under, of course, more congressional scrutiny than has existed previously. We do have some evidence base for what works, and we have a lot of research that's happening now across the government and academia. We also have AI systems and tools that are being created. There are parts of the federal government that are further along in using them than our public health agencies are. These systems hold enormous promise for helping to identify and respond to misinformation and disinformation in real time. Regardless, human analysis will still be needed for alerts and action determination. At least we hope so. CDC has made addressing misinformation and disinformation a standard part of our communications planning, but we're in the process of setting up more robust systems, processes, research, trials, and evaluation to move forward. You can move to slide 3. Obviously, many groups are working to address the problem and doing important work. CDC is only one player in the field and just beginning a coordinated agency-wide program. However, CDC is already seen as an international leader in the space because of its global vaccine work. We can move to the next slide. So what are we doing to build on the work we've done as an agency? We're creating new systems and tools to monitor and rapidly alert to arising topics for misinformation, increasing our capacity to monitor, categorize, and respond in a timely way across the agency, responding rapidly through agency communications channels, media and fact checkers, third-party validators, partners, and other influencers. In summary, we're trying to recognize a troubling trend faster, put clear guidelines around when we should respond, and then increase the speed with which we actually do that. The bottom line is encouraging trust in CDC's mission and its science to increase healthy behavior and to advance the public's health. Next slide. As you all know, many government agencies are working on this problem, and we're coordinating with them. So there's a lot of room to continue to strengthen that work. I mentioned some of the daily work, but I want to share a bit of what else is going on at CDC. The Office of Communications is convening and working with others at CDC to identify best practices and coordinate actions. And we are building our new system to monitor, categorize, and alert us for potential misinformation topics. In our centers, the Office of Readiness and Response through the Joint Information Center monitors for media and social trends daily, including health narratives during responses. So think COVID, Mpox, or now, of course, Marburg. This center is also funding this workshop. The National Center for Immunization and Respiratory Diseases publishes vaccine insights reports, internally and externally, on mis and disinformation being circulated with recommendations that broadly give suggestions for responding. This group is funding research and projects on social listening and response in communities, working with universities and other federal agencies on algorithms and smart systems to map and respond to potential misinformation. Next slide. The big question is, can we collectively flatten the infodemic curve? And I do want to stress that word collectively. Public health partners working together across federal, state, and local levels to ensure that people have accurate information. That's the only way we're going to make a real dent in mis and disinformation, is by working together. We hope this workshop, through your participation, will help us identify roles where we can and should be playing, What are the best ways we can do that and help our state and local partners? Better understanding the formidable forces that we're up against. As much as possible, we want this convening to focus on the practical, on the evidence-based actions that work and can be implemented. We hope you will feel our sense of urgency in confronting this challenge and an acknowledgement implicitly of the stakes. And obviously, we hope we'll provide any other considerations for a subsequent meeting of federal agencies that the National Academies will convene. That's it for me, and I'm happy to turn it over to our next speaker.
So thank you so much, Director Griffis. We're actually ahead of time, so this is a good sign for the next 2 days. We appreciate your support and your leadership and these great opening remarks.